Good morning, good afternoon, good evening to everyone, and thank you for having me today. My name is Dr. Jeff Ritter. My focus today will obviously be on effective healthcare management in the 21st century. I have to mention that this is very early in the research process, and given all the changes that have occurred recently in the marketplace, I'm kind of leaning toward more of a focus in the area of healthcare marketing from the perspective of when markets are disrupted and there are mega changes occurring. So this is a work in progress, and again, thank you for having me today. So I want to start out by talking about leadership as it relates to healthcare. I have a few theories listed here, and again, I'll be brief and stay within the time frame. The great man theory, trait theory, and servant leadership. Servant leadership is an essential component of healthcare success in terms of individuals and leaders giving back to the community, supportive of patients, supportive of employees, so on and so forth. Something that's of great interest, as I mentioned, it's called clutch leadership. It's leading through disruption, which is, again, as I mentioned, my new area of interest. This is why I may be changing direction, but that'll come later. But what's most important from a leadership perspective is utilizing analytics and actionable data to make decisions, relying on key feedback. Leaders must invest in coaching, and most importantly, and this relates back to clutch leadership, leading when it's hard to lead. Again, given what's happening in the current market in a variety of sectors, this has become even more relevant. So again, as we face disruptions, there are in the United States significant regulatory demands as it relates to healthcare and the impact of healthcare. Significant economic trends. I should probably have a presentation solely on economic trends, but I'm not going to do that right now. But essentially, the market has changed, the world has changed, it's changing as we speak, and it's impacting healthcare and many other sectors. The major technological change is, of course, AI, and AI is being used in healthcare quite significantly, for the most part in a very positive way. I'll give you some examples of that. In the United States, transparency is a major issue. It's a complex healthcare system with no one lead organization or entity. For the most part, it's made up of the private sector, the public sector, government programs, private insurance, self-pay, and a variety of other things. The aging population has a significant impact from an economic perspective, primarily in terms of treating the elderly, maintaining levels of healthcare quality, so on and so forth. Major changes and a major disruption is lower reimbursement. So providers who rely on funds from the Medicaid or the Medicare sectors are seeing lower reimbursement, less revenue coming in, while expenses continue to escalate and increase. We have now probably more educated and awareness of consumers than ever before, given the internet and the opportunity to learn about healthcare delivery, so on and so forth. And there's many other disruptions that I'm still kind of identifying and reviewing. So as I mentioned before, my research will continue to focus on these changes. I mentioned this earlier briefly. The U.S. healthcare system is a fragmented system with no one entity that oversees the healthcare delivery in the United States. There's immense and significant competition between hospitals, providers, pharmaceutical companies, nursing homes, skilled nursing facilities, you name it. There's a significance in the United States with federal and state programs, namely Medicaid and Medicare, along with the VA system, veterans programs, as well as the ACA or the Affordable Care Act, which makes up close to half of the healthcare delivery and population in the United States. So we do have some semblance of a government-based initiative through these programs. The system is a market-based, capitalistic, focused element where we see profitability and quality always kind of clawing at each other, trying to reach the top. And again, there's a level of complexity with the system. It's an excellent system. It's not a perfect system. It can always improve. And I'm doing additional research on the system itself as we speak. So some examples here, there's a medical director at a facility who's using something called Profound AI, which is helping to identify breast cancer in patients very early on, which is obviously a very, very good thing. So utilizing AI in this capacity is helping significantly from a clinical perspective. There's a vice president of Intermountain Health in Colorado that essentially she is using cutting edge technology. She's supporting her organization significantly, and by the use of advanced technology, showing greater positive outcomes. And again, in healthcare, and I'm sure it's pretty much the same around the world, outcomes and results matter without question. So these are just a couple of brief examples that I wanted to share with you. Now, getting back to the marketing, I should have mentioned my background. I'm primarily healthcare executive, entrepreneur, a lot of experience in marketing, professor. So I come to you with a varied background, which is the reason why I'm kind of shifting gears essentially. But the primary focus of marketing, especially as it relates to healthcare, we need to look at a new direction. It needs to be very targeted and specific. So whether you're a hospital, a provider group, a pharmaceutical company, you have to know and understand your target specifically and address the target's needs. We're shifting from image marketing to service marketing. There's got to be a significant service element associated with marketing and marketing strategy. From one measure for all to personalization, it's got to be personalized. The focus needs to be on long-lasting relationships, and we need to continue to build out robust databases to identify important elements of who we're serving and how we're serving to reach them. And again, obviously, the change from low tech to high tech. To continue, digital marketing is playing a significant and important role in healthcare. The return on investment is significant when healthcare organizations effectively and efficiently have digital marketing strategies in place. Many do, many still do not, and that becomes a deficit. Healthcare providers are becoming more sophisticated as it relates to marketing, utilizing social media and informational blogs to reach their consumers in a variety of ways based on their research, their outcomes, their affiliations. Again, the primary focus is on a segmented population, customized messages that are unique and different in the healthcare sector. Not that long ago in the United States, marketing wasn't really a major element in terms of how healthcare was delivered. Now with significant competition, globalization, the use of the internet, digitalization, the game has changed significantly. So we're going to see more and more engagement with significant marketing strategies as we move forward.
1 minute.
Was there a question?
No, 1 minute.
Oh, 1 minute. Oh no, I'll try to move fast. This is an exhibit that kind of captures how healthcare marketing is delivered through healthcare practices. I'm going to kind of go through that quickly. There's an example of a hospital system in the United States that identifies individuals right out of grad school, that puts them in an 18-month program, that trains them and teaches them how to engage and lead hospitals, incorporating financial stability as well as quality and outcomes. I wanted to mention that. So that is an important factor that I want to continue to build on. Performing under pressure, this kind of goes back to the focus of clutch performance. There's a study I identified with athletes. There's a correlation to healthcare leadership in terms of perceived achievement. That's another area of interest I have with regard to research. I think the mention of COVID-19 was, it was mentioned earlier. Major pandemic, significant impact. Healthcare, especially in the United States, many institutions and organizations were not prepared. Some, however, were and addressed it head on. And I've got some examples here that showed what they did and how they did it by embracing, identifying, using data, accepting the challenges and addressing the needs of the community. Here's some more information about it, about this organization, West Virginia University Hospitals and Healthcare System. I found another model that's used quite significantly with regard to connectivity and change, which I align closely to the marketing effort. A little about clutch leaders, and this is how they address their initiatives through focus and discipline, being adaptive, being present and available. And here's my brief conclusion. I'm sorry I had to go through this quickly. And thank you for your time. I hope I met the time frame. And I'm happy to take any questions.